From a NAS survey, 21% of people with axial SpA reported seeing an osteopath prior to receiving their diagnosis. With a prevalence of 1 in 200 adults in the UK, it shows that osteopaths are seeing these patients in clinic with undiagnosed axial SpA, and they're in the right place to refer quickly for the correct diagnosis and the right management. Osteopaths do face some challenges in identifying axial SpA in clinic, such as screening for lots of different symptoms that may be intermittent, and the fact that physical examination is often unremarkable. So osteopaths need to be knowledgeable in the many symptoms of axial SpA and screen for them regularly, with emphasis on historic symptoms as well as current. The key symptoms that should be routine for osteopaths to screen for are the symptoms of inflammatory back pain. So this means back pain that has originally started before the patient is 45 years old and has lasted longer than 3 months. Patients will often wake during the second half of the night due to pain, and they may report spinal stiffness lasting longer than 30 minutes. This pain and stiffness usually improves with movement but does not improve with rest. Patients may also describe alternating buttock pain, which is usually sacroiliac joint pain. It's also important to screen for the extra-articular manifestations of axial SpA, which are psoriasis, enthesitis, uveitis, which is inflammation of the eye, inflammatory bowel disease such as Crohn's or ulcerative colitis, and dactylitis, which is inflammation of a digit. Finally, osteopaths should ask whether the patient has a first-degree relative with spondyloarthritis. Some groups of patients have a longer delayed diagnosis of axial SpA, so it's important to screen regularly, particularly for women, people who already have a diagnosis of fibromyalgia, and people with hypermobility. If a patient has a number of symptoms of axial SpA, you can use the free online SpA tool to input their symptoms and create a graph showing the likelihood of them having axial SpA. Osteopaths can use this in conjunction with the NAS referral template letter to refer a patient directly to their GP for the correct investigations or onward referral to rheumatology. The referral template letter was created in conjunction with the Institute of Osteopathy and the Royal College of Chiropractors, and it was being validated by the Royal College of GPs and the Chartered Society for Physiotherapy. To sum things up, we are seeing patients in clinic who have undiagnosed axial SpA, so screening for inflammatory back pain, extra-articular manifestations, and family history can be quick and should be routine in clinic. We can help reduce the patient's delayed diagnosis, which helps their long-term prognosis and well-being.